High blood pressure remains one of the most critical and often misunderstood health challenges we face today. If you've ever found yourself confused by your blood pressure readings or curious about the latest shifts in medical advice, this update is essential for you. On August 14th, 2025, the American Heart Association, AHA, in partnership with the American College of Cardiology, ACC, and numerous respected health organizations, unveiled the latest 2025 guidelines focused on preventing, detecting, evaluating, and managing high blood pressure in adults. This new set of recommendations goes beyond just setting numeric targets. It centers on you, the individual, combining practical lifestyle approaches, scientific understanding, and useful tools tailored for real-life use. Whether you're managing your own health or supporting someone else, the goal is empowerment without overwhelm. Here's a startling fact. Nearly half of all American adults, approximately 46.7%, have high blood pressure, making it the single most adjustable risk factor leading to death worldwide. This new guidance emphasizes prevention first, but with readiness for timely intervention. While lifestyle changes remain the cornerstone, think heart-friendly diets, reducing salt intake, regular physical activity, and stress management. The guideline also encourages starting treatment earlier when necessary. This approach isn't just about avoiding heart attacks and strokes anymore. It now covers preventing kidney problems, type 2 diabetes, and even cognitive decline, such as memory loss and dementia. Yes, your brain's health is inseparably tied into your blood pressure. One of the game changers introduced is a smarter tool called Prevent, launched in 2023 and now officially part of these guidelines. This advanced risk calculator projects a person's 10 and 30-year risk of cardiovascular events by considering factors like age, blood pressure, cholesterol, and intriguingly, even geographic location. Including zip code, signals recognition of social determinants affecting health outcomes, something many guidelines have historically overlooked. Diagnostic testing has become more precise, focusing deeply on kidney function and hormone levels. The urine albumin-to-creatinine ratio test, which measures kidney health, is no longer optional but routine for everyone with high blood pressure. Similarly, the aldosterone-to-renin ratio test, used to catch a specific hormonal cause of hypertension called primary aldosteronism, is now recommended for a broader group of patients, especially those with severe blood pressure elevations or sleep apnea. Even minor blood pressure increases can subtly diminish memory and thinking skills over time. Because of this, the guidelines now advocate for a systolic blood pressure, the top number, below 130 millimeters H, to better safeguard cognitive function, sparking new conversations about what normal really means. Personalizing medication is another key shift. For certain groups, people with type 2 diabetes, obesity, or kidney disease, one medication often isn't enough. The updated advice supports starting treatment with drug classes such as ACE inhibitors, ARBs, calcium channel blockers, or thiazide diuretics. In cases of stage 2 hypertension, readings of 140-90 millimeters H or higher, combination pills, which combine two medications into one, are preferred. For some patients coping with obesity, there's growing support for adding newer drugs like GLP-1 receptor agonists, which you may have seen discussed prominently in recent health news. Pregnant individuals with hypertension also receive renewed focus. High blood pressure during pregnancy can lead to serious complications like preeclampsia or early labor. The guidelines now recommend low-dose aspirin, 81 milligrams daily for certain cases. Recommend tighter blood pressure control thresholds at 140-90 millimeters Hg during pregnancy, and stress the importance of ongoing blood pressure monitoring after childbirth since hypertension can persist postpartum. Let's talk about the lifestyle essentials that form your frontline defense against high blood pressure. Here's a practical checklist for everyday living. Salt. Aim to consume less than 2,300 milligrams per day, ideally closer to 1,500 milligrams. Fun fact, most excess salt intake actually comes from packaged and restaurant foods, not the salt shaker. Alcohol. Best to avoid if possible. If you do drink, keep it within 2 drinks per day for men and 1 for women. Stress. Not about eliminating it totally, but managing it effectively. Think mindfulness practices, like meditation, deep breathing exercises, yoga, or simply finding enjoyable ways to relax. Weight. Even a modest loss of 5% of your body weight can lead to meaningful blood pressure improvements. Diet. Embrace the DASH diet, dietary approaches to stop hypertension, which focuses on fruits, vegetables, whole grains, nuts, seeds, lean proteins, low-fat dairy, and healthy oils. Exercise. Strive for a minimum of 75 to 150 minutes per week of cardiovascular and/or strength training activities. You've got this. Also consider monitoring your blood pressure at home, not just during doctor visits. Home tracking gives both you and your healthcare provider a fuller picture, helping to personalize your treatment plan. Dr. Daniel W. Jones, a leading expert and chair of the Guideline Committee, reminds us high blood pressure is the most common and most modifiable risk factor for heart disease. He emphasizes that earlier, more precise intervention tailored to each person's unique risk can dramatically reduce the burden of heart disease, kidney disease, diabetes, and dementia. Interestingly, this guideline update isn't just crafted by cardiologists. It's the work of a broad coalition that includes physician assistants, nurse practitioners, clinical pharmacists, geriatricians, and organizations representing Black cardiologists and preventive cardiovascular nurses, among others. This diverse collaboration underlines the comprehensive, inclusive vision behind these recommendations. At its heart, the 2025 Blood Pressure Guideline is more than a list of numbers or a prescription pad. It's a strategic roadmap designed to help you live a longer, healthier, and cognitively sharper life. Managing blood pressure well is truly about preserving not just your heart and kidneys, but your brain too, ensuring you enjoy your future years with strength and vitality. Here's a question to ponder. With all these tailored interventions and lifestyle changes, how do you feel about the balance between medication and natural approaches? Should there be greater emphasis on one over the other? Feel free to share your thoughts and experiences. Sometimes the most useful insights come from those walking the journey every day.